Welcome to the session where we are on climate health and equity tools from the Lancet Countdown. Before we share about the Lancet Countdown on Climate and Health U.S. brief, Dr. Renee Salas and I will quickly introduce ourselves and our connection to the brief. I am Dr. Natasha DeJarnett, an assistant professor in environmental medicine at the University of Louisville Christina Lee Brown Environment Institute, and I research climate and health as well as environmental health disparities. In addition, I teach at the George Washington University Milken Institute School of Public Health. I'm proud to serve on the working group for the Lancet Countdown on Climate and Health U.S. brief, where I get to weigh in on the indicators selected each year, contribute reviews of the annual publication, and help strategize the dissemination of findings. I'll now turn it over to my friend and colleague, Dr. Renee Salas, lead author of the U.S. brief. Renee, please introduce yourself and share more about the Lancet Countdown on Climate and Health.
Thank you so much. It's such an honor and privilege to be here with you. So I'm an emergency medicine doctor by training. I work at Massachusetts General Hospital here in Boston, Massachusetts, and have a variety of appointments around Harvard. But I've had the honor and privilege of being the lead author since 2018 for the Lancet Countdown U.S. brief. Now, you may be asking, what the heck is the Lancet Countdown? It is a two-syllable word here, and what exactly is it? So I like to view it as an annual checkup, just like you go to the doctor to get an annual checkup. At least I hope you do. And if you don't, you should. And when you go for that annual checkup, you try to understand, where are we in regards to how climate change is harming health around the globe, and how well are we actually implementing the interventions and solutions we need to tackle this problem. So the Lancet is one of the world's leading medical journals, and there's a group of international scientists who publish research indicators in order to track progress or lack thereof across these different areas. Now, it may seem strange, for example, for the Lancet to be tracking renewable energy across the world, but I think it's so important to really show how the implementation of renewable energy and the transition away from fossil fuels is actually a prescription for improved health and equity, like we'll talk about. Now, we recognize that painting a global picture does not translate to action where it needs to happen, both within countries and even within states and local municipalities. So there's a companion brief, which is where you and I get to work together, where we actually get the data that's just for the U.S., and we frame this with an amazing working group of now well over 70 institutions, organizations, and centers that work at the nexus of climate change and health. And we present that data, and we also give 3 key policy priorities for that year.
Wonderful. So the 2021 U.S. brief describes 3 climate and health indicators, and I found the information on drought to be quite interesting, as there are broad and unexpected health consequences linked with drought. Dr. Salas, would you please share more about what you uncovered on drought and health?
I think each of the areas that we picked were things that our country has really experienced recently, as our rose-colored glasses have been knocked off in the ways that climate change is truly here and now. And drought is one of those that really shows, as you said, how surprisingly broad some of these health harms can be. So drought not only intensifies the risk for heat-related disease, but it actually makes water quality worse, whether we're talking about harmful algae blooms or actually concentrating water pollutants. It actually affects infectious diseases. So, for example, mosquitoes can spread West Nile virus easier. And there's another fungus that is called valley fever that has more favorability of being spread during droughts. There's also impacts to mental health and to a variety of respiratory conditions, can cause breathing problems, and it's especially of concern for people who have underlying lung diseases. Now, as we know, and this is a theme of climate change, that these health harms are not experienced equally. And so there are certain communities that experience some of these harms disproportionately. And so, for example, nearly 65% of farm workers identify as Hispanic. And so they're going to face increased vulnerability to some of the extended drought-related economic impacts that we see, which can lead towards mental health harms. There's also many cultural threats as we think about indigenous communities that are already struggling with long-term drought. in consideration for their cultural and medicinal plants and drinking water supplies. Those are just a few examples, but again, the theme is highlighted here.
Well, thanks for that description, Renee. And the impacts of drought are certainly more than meet the eye. But what also stands out to me is the interconnectedness of the indicators that have been selected for this brief. So I'll change gears to extreme heat, another key indicator that was included in the 2021 U.S. brief. And I'll note that drought actually worsens heat waves. So we're experiencing more frequent and more intense extreme heat events. And this is particularly concerning because extreme heat can impact health in many ways. First, it is the top cause of natural weather-related death in the U.S. Further, extreme heat can increase the likelihood of heat-related illness like heat exhaustion and heat stroke. It can adversely impact our heart and lung health. It can contribute to poor sleep quality and is associated with adverse mental health impacts, as pointed out in the brief, including higher suicide rates, as well as increased crime rates that occur during extreme heat events. More than a third of urban heat-related deaths that were between 1990 and the early 2000s are attributed to climate change. And in fact, not only are these health risks from extreme heat growing, but these impacts vary across different populations and geographies in the US, as you pointed out. So there are several populations that are disproportionately burdened, leaving them with a greater threat to health and equity under these more frequent and more intense extreme heat wave events. And these include people of color, who are more likely to reside in areas where there are urban heat islands. These can be up to 20 degrees hotter at night compared to surrounding areas. Older adults also. Older adults may have comorbidities or pre-existing illness that make them more susceptible. Children are more likely to be playing outdoors. They may not know when they've overdone it, need to take a break and cool off. And both very young children and older adults are experiencing a higher number of days exposed to heat waves, as pointed out in this brief. Also, people with pre-existing illness, not only older adults, but those with pre-existing illness are also more susceptible when it comes to exposure to extreme heat. Further, outdoor workers. Consider those who work in agriculture or construction, or those that work in non-air conditioned environments that may not have the opportunity to cool off when doing work, for example. Further, people experiencing poverty as they have less access to air conditioning. It's similarly consider incarcerated persons because they may reside in facilities that don't have air conditioning. I really appreciate that the brief pointed this out and brought incarcerated persons into the conversation. And then lastly, in terms of geography, people that live in historically redline communities, these communities are known to be hotter, have less tree cover, and also have worse air quality than non-redline communities. So you can see that place matters when it comes to extreme heat exposure. And this emphasizes the connection to health equity in a number of ways. Infrastructure may not meet the needs of communities that are experiencing intensifying heat waves. And poorly designed infrastructure, like limited access to air conditioning, is one example. So consider the 2021 heat wave of the Pacific Northwest. Infrastructure was not robust enough for widespread air conditioning access. In fact, many people did not have access to air conditioning, leaving them at heightened vulnerability during the heat dome. And during that time, the ER visits were 70 times higher than normal, and around 600 people died from heat-related illness in just 1 week. So I want us to consider the infrastructure challenges and how that can bring about health and inequitable access when it comes to protecting our communities. So I'll transition back to Renee to talk about wildfires. But first, I just want to share that a solution is building infrastructure to support equitable access to support air conditioning. And case in point, in 2019, air conditioning prevented 48,000 deaths in older adults over age 65. So I didn't want to leave you in the dark space. I know a lot of that information was pretty heavy, but we do have solutions. So Renee, I'll hand it back to you to share about the final 2021 indicator, wildfires.
Well, just listening to you, I just want to reflect on two things. And I think the first off is, yes, air conditioners can serve as an intermediary solution, but we know that they're also contributing to the production of greenhouse gases and fossil fuel generated air pollution, which is thus just further harming health. So we need additional solutions that can really begin to get to the root cause so we can find prescriptions and ways to improve health that actually are not then causing further harm themselves. And I think also, you hear all this data and you hear all of these facts, but we have to realize to put faces on these statistics. And so I just want to share a quick story. And that was an elderly gentleman whose wife called 911 because he was acting confused. Now, I knew the EMS crew really well. And at this point, and they said that when they climbed up to the top floor of that couple's apartment, that when they opened the door, they felt like they were being hit with heat from the Sahara Desert. Now, this couple, during record-breaking heat, only had one window, which was partially cracked, so they had no access to any cooling. Now, when we transferred this gentleman onto the stretcher, we very quickly got his core temperature, so trying to get a true representation, and it was 106 degrees Fahrenheit. So this man's brain was literally cooking in what we call heat stroke, which is the most life-threatening form of heat illness. So this gentleman was elderly. They obviously had limited resources and no access to cooling. And these types of stories are happening across the country. And I think that's another piece of this. And to transition into wildfires is the recognition that we are all interconnected with these threats. So wildfires, which again are predominantly increasing in the West. Now, in July of 2021, there was that massive Dixie fire. But the smoke traveled across the country. And I don't know about you, but I actually saw hazy skies as a result of the smoke. And New York City had its worst air quality day in 15 years because of smoke that traveled all the way across the country. And so despite the fact these things are happening maybe in places where you don't live, it affects all of us and we are really bound together. And I think that's another theme that we hope comes out from the U.S. brief. Now, wildfire smoke increases risk of heart and lung disease, increase in premature death, so dying early, worsens mental health, and there's a greater risk of preterm birth. But again, that theme that not everyone is equally impacted. And so their discriminatory housing policies have actually led to things like certain communities and marginalized communities being concentrated in high-risk areas. And thus they're at higher risk, not only for destruction from the flames, but also potentially for exposure from the smoke. And so Black, Latino, and American Indian families, as well as other low-income communities and incarcerated persons, again, another population you mentioned in regards to heat, that work in wildland firefighting programs have been shown to be at greater risk for the health harms from wildfires. Now, all of that seems really heavy, but there are things we can do, right?
Absolutely. So central to the U.S. brief are the policy recommendations. And these recommendations are centered on health and equity. And all too often, climate policy recommendations do not consider the benefits or unintended health and equity consequences. So what I love about the U.S. brief is that the policy recommendations are written through a lens of health and equity based on the latest supporting evidence. I'll turn it back to you, Dr. Salas, to share more.
I think a theme I also hope comes out of this is it's not just important that we do something in response to climate change, but how we do it is critically important. And we have to use something to guide our response. And we think that we all should be putting health and equity as those guiding priorities in order to make sure that we are optimizing the health and equity benefits from our solutions. And I think sometimes we can be really surprised and humbled by things that we think are doing good may actually be doing unintended harm. So for example, there's a research that has shown that we know we want to transition to electric vehicles, but where we put electric vehicle charging stations, if it's drawing from fuel and energy that is fossil fuel driven, then that actually is going to be increasing air pollution potentially in certain communities, and thus worsening health for those communities and worsening inequities. And so that is just an example of how we need evidence to guide our path forward so we can understand what these impacts are and iteratively make sure we adapt and do what needs to be done to prioritize health and equity. And so one of our main recommendations is, of course, getting fully upstream to that root cause. And we're calling for an urgent and equitable economy-wide greenhouse gas emission reduction. And we want to follow the pathway that keeps us from going above 1.5 degrees Celsius. And we are thus also saying that 40% of those investments have to be directed towards improving air quality in under-resourced communities, because we know that that transition away can begin to have near-term health benefits now. And we really stress this in the 2020 brief, showing that there are health harms from air pollution. And anyone who's seen during the pandemic how horizons cleared and you could see mountains and landscapes that you haven't seen before, this improves very quickly. So we can improve health now while also minimizing the health harms and the inequities from climate change down the line.
I love that there are policy recommendations around mitigation. It is of importance, but I love that equally there are policy recommendations that are also around adaptation. And I had someone ask me years ago, I speak a lot about adaptation. I have spent much of my career informing policy for climate and health adaptation efforts. And they said, why are we talking about adaptation when we need to pollute less? We need less greenhouse gases going into the atmosphere. And I said, we need both, because we're experiencing we're experiencing the health impacts of climate change right now. So for the sake of making sure everyone is on the same page, I'll define adaptation. These are the steps that are taken to protect people and communities from the health risks that are associated with climate change. So what we're experiencing right now. So adaptation efforts must be local and they must be specific, because climate change, though this is a global phenomenon, we're experiencing it locally. So the U.S. brief describes how local climate-specific health research constructed through multi-sectoral partnerships can directly inform the development and implementation and evaluation of equitable actions to protect health. And in the U.S. brief, the authors raised that air conditioning is an example to inform climate and health adaptation recommendations. And I find this to be a powerful example because access to air conditioning is a key adaptation factor, where air conditioning is the number one protective factor against extreme heat. And the American Public Health Association describes it as an essential resource for vulnerable populations. But there are a number of barriers, including that many households lack access inequitably, also that power outages occur during peak demand, that energy costs are quite high. There are energy cost disparities that are higher for African American and Latino households compared to non-Hispanic white households. And there's a lack of affordable, renewable, and this lack of affordable and renewable energy puts a greater strain on African American households in particular, leaving African American households at disproportionate risk. Additional barriers to having cooler environments includes not having access to weatherization or efficient resources. And then, as Renee pointed out, it does not go unnoticed that the use of air conditioning is often powered by the burning of fossil fuels. And this creates a cycle that contributes to climate change and ultimately the health burdens that result. So air conditioning, as Renee eloquently pointed out, cannot be the primary strategy to address extreme heat. It would not be sufficient. So policy solutions are needed at multiple levels, and those include well-communicated action plans, tax incentives for green building codes and sustainable energy solutions, equitable implementation of interventions like cooling technologies, heat pumps, weatherization, cooling roofs. In addition, We need increased green spaces in urban environments and access to water bodies also in urban environments where nature can be a powerful adaptation strategy. Other policy options include access to adaptation like air conditioning vouchers, geothermal or solar tax incentives or rebates to power air conditioning, eliminating electricity surge pricing, creating a moratorium on power shutoffs, and then also ensuring equitable access to cooling centers. Not just that we have cooling centers, but that they're accessible to all. So these recommendations can protect health and improve health equity and increase resilience in the face of extreme heat. Renee, I'd love to turn it back to you about economics.
First, just listening to you eloquently map out all of that key information, this unprecedented crisis really mandates unprecedented collaboration, and we need people from across every sector to work together to figure these problems out, because we have the solutions we need in order to make sure that the health protections we're implementing are not contributing to the problem. And we have everything we need, all of the tools. We just need to get the right people in the room and get that political will with which to implement these prescriptions for health. So yeah, the last thing, money, right? Economics has to factor into anything. But yet another example of how we need to bring in economists, and especially health economists, to help us be able to tackle this problem. And the reality is that we are already paying for the inequitable health harms of climate change. And it's been estimated, just looking at one type of health harm, like heat-related illness or wildfires, that we're paying potentially billions or trillions every year. Now, obviously, that different people are paying, and it's very complex to think about how this is unfolding. But I think a big thing that we stress is that we have to make sure that we're taking these costs into account, because right now they're not being accounted for. So as we think about all the framing, the money that we have to put into different health protections or thinking about the equitable transition away from fossil fuels, sure, that costs some money up front, but evidence has shown us that it is cost saving in the end, because we are already spending far more, if not preventing these harms in the first place. So that is a big take home, is that we say we have to make sure that these health related costs are accounted for and factored in.
I think that is of vital importance and often left out of the conversation. The conversation on economics and climate change often goes in a different direction, but investing in climate action not only is a cheaper option, but also it is cheaper through protecting health and the health benefits that result. And too often, that's not in the equation, and too often that's not in the conversation. So add that to the list of things that I love about this U.S. brief, that this brief provides solid evidence there as well. So parts of our conversation have been heavy. We have described the health and equity impacts heightened in the Lancet Countdown U.S. brief. And I'm really glad that not only have we pointed out the problem, but we've also provided solutions by sharing about the policy recommendations. And further, I'm really proud that we're able to share some of the great resources that come from the policy brief. So these resources are free to download and share. And Renee, I'll turn to you to share about some of the resources that are directed towards the general public.
So we want this brief to be part of a toolbox. So we have brought together the best scientists and experts from across the U.S. to weigh in and make sure that we are presenting the latest science and the most pressing policy needs, so we can be coordinated in how we're tackling these. Of course, these are just 3 policy needs of many. So we try to highlight different things every year, and every brief builds off the other one. So we'd encourage you to also look at previous years, because we try to have different infographics and other tools that, again, are still very relevant today. So in order to bring this to life, we have created some additional resources, and one of them is for the general public. So it's meant for, as you sit and try to process this information, what is it that you can do? And so there's a companion resource I would encourage you to, if anything, maybe read first before tackling the brief, in order to really provide framing and, more importantly, to really stress what you can do, because we all can do something and we're all in this together.
Wonderful. And I want to rest on that for a moment. There's something that we can all do. And that's quite important when it comes to climate, not feeling like we're alone in this space, that there is something that we can do, because it can be overwhelming, but these tools and resources are easily digestible and can give us that empowerment that we need to take action. I very much appreciate that the tools and resources are published in both English and Spanish. And one of the resources that I found exciting is the new Science for Scientists fact sheet. And this is written for my people. I am a scientist. And so this fact sheet summarizes the newest scientific information around the key indicators of extreme heat and wildfires. And informed with the latest science, it highlights emerging concerns like the transmission potential of dengue virus in the US, which is increasing. In addition, using the most recent data, it makes a very strong case to support adaptation, noting how air conditioning prevents death, but access is inequitably distributed, and the energy that's used to power air conditioner also often comes from fossil fuel sources, which thereby contributes to deaths here in the US. So it points out these important factors lined with the most up-to-date evidence, and the fact sheet makes the connection between mitigation action and health benefits as well. So I'm very appreciative of this fact sheet. I'll turn it back to you, Renee, to share more.
So there's also one for health professionals, and recognizing that as health professionals, we have an enormously powerful and trusted voice, and we need to use that voice in order to not only protect the patients and communities that we're entrusted to serve, but also to advocate to those in power that we need to make these larger transformational changes that we can do. Again, we have the solutions we need and the technology we need for an equitable transition away from fossil fuels. We just need the political will, and health professionals can help frame climate change as a health inequity crisis, which is what it is. And thus these treatments or prescriptions, as we call them in this handout, are actually just like prescriptions that a health professional would write in an office for their patient, and arguably maybe even more important with wider health benefits than just a medicine can have. So encourage you to look at that and share it with all of your health professional friends.
Excellent. And I mentioned before how climate change is experienced locally, and our experiences can vary at the regional level in the US. So additional tools to complement the 2021 US policy brief include 4 fact sheets that describe regional impacts, including a fact sheet on the Northeast that describes extreme heat, extreme weather, poor air quality, and infectious diseases, including Lyme disease, and how this takes place across the Northeast and how this is being experienced. Each of the fact sheets also describe how structural discrimination deepens health inequities among populations of color in those specific regions. And they point out specific recommendations directly to the regions around increasing research and local solutions. So in the fact sheet on the South, this fact sheet describes extreme heat, extreme weather, poor air quality, water pollution, and infectious disease or vector-borne disease experiences in the South and recommendations for the region. In the Midwest, the climate and health threats include flooding, water pollution, extreme heat, and infectious disease. What I also appreciate about the Midwestern fact sheet is that children and communities are put in the spotlight. Those that experience structural racism and children with their inherent susceptibility listed among greatest concern due to their inequitable risk. And then the last fact sheet is on the West, and this describes heat, drought, and wildfires as key indicators that describe the inequitable burden of mental health impacts of exposure to climate events. So I really appreciate that mental health is brought into this conversation. As I mentioned before, the economic benefits are not often brought into the conversation. Certainly the mental health aspects of climate burdens also need more attention and more spotlight, especially as we're experiencing more frequent and more intense climate events. So I appreciate these regional fact sheets that are specific to all the locations that we may reside here in the U.S. With information tailored just for our region. So Dr. Salas, I am so grateful for the opportunity to serve on the Lancet Countdown on Climate Change and Health U.S. Brief Working Group alongside you. I am grateful that we could share the great resources that accompany the brief here today. And I just want to thank you and all the attendees for your commitment to action on climate. Over to you, Grace.